Hello, my name is Dr. Alan Laing, Principal and Senior Consultant for Rehmann Healthcare Management Advisors and an MDA member dentist. For over 30 years, our firm has provided business solutions to Michigan dentists in the areas of accounting, tax, management consulting, practice valuation, brokerage, retirement plan, setup and administration, as well as insurance and financial planning. We have 10 offices throughout the state of Michigan and thus are positioned to serve virtually every Michigan dentist's business needs. Today I would like to briefly discuss an important topic at the forefront of our industry in light of current recessionary forces gripping our state, as well as the potential loss in profitability of many Michigan dental practices. This topic centers around declining dental insurance reimbursement, as well as the continued erosion of dental benefit coverage for many Michigan employees and retirees. Many of our dentist clients have contemplated discontinuing participation with dental insurance providers. It is the focus of my comments today to highlight the factors to be studied in order to make an informed decision on going non-participation with dental insurance carriers or not. First, what is the main objective for a practice contemplating going non-par? Is it to raise fees and thereby garner stronger revenues? Or is it to ensure full payment of your current fees? Or is it to treatment plan and time procedures more to your desires and the patient's need versus the whims and requirements of an insurance carrier? Or is it to escape the tedious and time-consuming nature of dealing with a multitude of dental insurance carriers and their plan requirements? Chances are strong that it's a combination of all these factors. But as a side note, many non-par offices continue to file claims and pre-authorized procedures on behalf of their dental patients. In order to make an informed decision about this topic, it is important that you know the dynamics of your practice and especially your patient base. What is the percentage of patients that are currently insured versus not insured? What are the number of patients in each dental plan? What are the number of patients that are currently employed in industries that are struggling? What is the percentage of patients in your practice that have come to see you for greater than 5 years? What is the percent of patients that are in households that have incomes less than $50,000 a year? And of these, how many are dual income versus single income? Also, do you offer payment plans to your patients currently? And if so, is your collection policy strong? And finally, have you studied your competitor base in your immediate area? In the past, rural and small town practitioners found it easier to go non-par because of the competitive nature of their areas. However, now, suburban and urban practitioners are finding other factors involved other than the competitive nature. However, in studying your competitors, of those in the immediate area, how many are currently non-par? And how many fit your demographic profile as to age, gender, and ethnicity? And finally, a factor that comes into play that is often overlooked and is not tied to dollars and cents is really who you are as a practitioner, what your value base is. Are you more of an entrepreneurial, business-oriented, extroverted team leader? Or are you more of the back office clinician that allows the staff to run the show, so to speak? Introverted versus extroverted. Do you grasp change or do you abhor it? These are very important issues to really study yourself in making this decision as well, in that it's not simply a dollars and cents issue. Now, after gathering the answers to all of these questions, your ultimate focus becomes, how many patients may I lose if I go non-par, whether I raise my fees or not? Quite honestly, the best answer comes from you and your staff. Now you also ask, what is the potential revenue gain or loss upon such a move? Again, in the short term, it is very, very critical to understand the issues and study your patient base before you can even closely quantify such a decision. But let me ask you this, and ask yourself this question. How many patients in this current economic climate may you lose anyway if you make no changes at all. Whether you ultimately go non-par or not, in these challenging times, you'll need to solidify a strong collection policy and potentially open the door to extended payment plans to your patients if you don't already do so. Going non-par will undoubtedly create more need for extending payment plans to your patients and the monitoring of these payments. Knowing you may need to play in-house banker, this may ultimately tip the scale to your decision making. I will leave you with this one final note. Dental insurance as we know it has only existed for less than 40 years. Do we know if it'll exist 5 years from now, 10 or 20? Only time will tell. I hope I've provided you some insightful information on this topic. Good luck in your future endeavors.